So PCOS, or polycystic ovarian syndrome, has several problems that often need treatment. The biggest one is the anovulatory bleeding, or the irregular periods, but also the obesity and abnormal hair growth can be a problem for people that need treatment. So let's talk about the abnormal bleeding first. The way we treat the irregular bleeding with PCOS really depends on the goal of the patient, and it kind of goes into two categories. Does the patient desire to get pregnant, or does the patient need birth control or not want to be pregnant at that time? If the patient doesn't want to be pregnant, the mainstay of treatment is usually birth control pills. Birth control pills work very well at making the periods nice and regular. It protects the uterus from a uterine cancer, and it can also have some other beneficial side effects. Particularly, it can decrease the amount of abnormal hair growth. So you kind of get two things out of it. Now, if someone doesn't want to have birth control pills, there's other things that can be used. The patch and the ring are both like birth control pills and will have similar favorable side effects in that they'll make the periods regular and probably also affect hair growth in a similar way. So all those things, in my opinion, are sort of equivalent treatments. They're just different ways of getting the medicine into the body. Now, for someone who does not want to use birth control pills, other things can be used. The Mirena IUD will protect the uterus, but it won't give the, it will also give birth control, but it won't give the side effect of helping hair growth. Likewise, the contraceptive implant also probably helps protect the uterus, although it can make the periods irregular, but at least in a safe way. It also, like the Mirena IUD, won't help with hair growth. Provera is a similar situation. Now, if someone that doesn't need birth control but isn't particularly trying to get pregnant and doesn't want to be on birth control pills, another option is to use what's called cycling Provera, where we use just the progesterone component of the birth control pill, and we just give it for 10 days at a time to bring on a period. And that can be done every 2 to 3 months. And so if a woman's, what I usually tell women that want to do it this way is that if you go 2 months without a period, go ahead and take the Provera. I usually give it to them for 10 days. And then sometime that week after the Provera is given, the period will come. And that will protect the uterus from a uterine cancer. It will also keep things from building up too much so that the bleeding won't be too heavy. And so that's another way to treat the hormonal problems and the abnormal bleeding with PCOS. However, that also usually does not make hair growth any better. So that's how we deal with the bleeding in women that aren't desiring pregnancy. In a woman that does want to get pregnant, usually Clomid, or clomiphene citrate, is the medicine that works best. And the way that works is we'll give a woman the Provera for 10 days, and that will bring on a period. And then we'll give them Clomid for 5 days during the cycle. Usually cycles day 5 through 9 is the way it's traditionally given. And what that does is it sort of tricks the brain into thinking that the estrogen levels aren't very high. It looks like a little dip in the estrogen because it's what's called an agonist-antagonist, and so it keeps the brain from seeing the circulating estrogen. Then you take that for 5 days and stop it. To the brain, it looks like the estrogen levels are peaking, which is the signal to start the ovulation process. And it sort of tricks the brain into getting the ovary to ovulate. And it works quite well. So for women that want to get pregnant, they'll take the Clomid for the 5 days, and then they'll have intercourse. Usually we recommend every other day for about a week to 10 days after the Clomid. And then we'll test them to see if they're ovulating. It works quite well, and most women that have PCOS will ovulate on the clomiphene citrate, or the Clomid. The risks of the Clomid are small. There's about a 7% chance of twins, so it's about twice the percentage of the general population, but it really doesn't cause triplets or higher order multiples. This isn't going to turn you into Octomom. Otherwise, it's very safe. Some women have some sort of PMS symptoms. When they're on it, they'll get maybe headaches or mood swings, sometimes even some cramping, but usually not too severe. And so that's usually the easiest treatment. The medicine's quite cheap, and so it's not one of these infertility treatments that are going to make you broke. Now, if Clomid doesn't work, the next step is a medicine called Glucophage or metformin. And that's really a diabetes medicine, but 80% of women that don't ovulate with the Clomid will ovulate with the metformin, which is also called Glucophage, combined with the Clomid. And so that's another medicine that we can add on that works quite well. So that's the treatment for the irregular bleeding for women that want to get pregnant. Now, what about the hair growth? Well, I already told you that birth control pills can help slow the hair growth down. There's a medicine called spironolactone that can also work well for hair growth that has very few side effects. Spironolactone is very bad to use if you get pregnant, and so it's important to be on birth control pills while you're on the spironolactone. The other things that can be done are things like shaving and plucking, which are obviously very temporary fixes. Electrolysis can work, but requires many treatments over a long period of time. There's a cream that is sold that's very expensive that does work, but as soon as you stop using it, the hair comes right back. So if you're going to spend that kind of money, then your best bet is really to use laser hair removal, which is really the thing that will work permanently and best. It is quite expensive, but if you really want to get rid of the abnormal hair growth, really laser hair removal is the way to go for that. Now, the obesity is a little bit harder to deal with, and what some people use is that same medicine I was talking about before, that diabetes medicine, Glucophage or metformin, and that can be given, and some people think that everyone with PCOS should be given the metformin because there is often insulin resistance. Well, there's not a lot of data that really helps. In fact, there's some pretty good data that it probably doesn't, although in certain situations, in women with very high fasting insulin levels, or really as a treatment to help the obesity, Glucophage can be helpful. It does have a lot of side effects, but not dangerous side effects. It can cause diarrhea and nausea and vomiting and things like that, but it tends not to be a real dangerous drug. So that's a medicine that some people add to, say, birth control pills or the Clomid if necessary. And some people believe that women with PCOS should be on that all the time to help some of the metabolic symptoms. Women with PCOS are at increased risk of diabetes, and so if diabetes develops, then metformin is certainly indicated. But for women that aren't diabetic or have high insulin levels, it may not really be helpful and does have some side effects. So that's the treatment of PCOS in a nutshell. There are certainly other treatment modalities, but those are sort of the generalities.